Okay, let me simply introduce iCON. iCON is a BC emergency digital emergency program. Is conducted by Dr. Kendall Ho. It's been gone on for 17 years, and it will give to multicultural community patients and the family, giving everybody the chronic education, prevention, and self-management, and through the health webinar and also using online information, it can increase the patients knowing the management and also the lifestyle and also prevent and reduce the risk. And also at the same time, it would promote communication between community members and health professional, and also optimize the people's knowledge of digital information and improve their life quality. Okay, well, so today we have many speakers to talk on many topics. This is to strengthening health and wellness as we age, to understand frailty. This year, we only have one webinar just for one day. Today, we arranged for 3 hours to broadcast here. Our Q&A will be postponed to August 19. Please pay attention. But today, you still are able to pose your questions. Okay. Today, we are very fortunate to have many medical VIPs talking to us many aspects of frailty, to share resources, and also as we age, to strengthen our health. And we have Dr. Thomas Ho. He's a family doctor. Amy Yu, she's a registered dietitian. Wendy Lam, registered occupational therapist. Nicole Tai and Emily Peck, registered physiotherapist. Dr. Tigerson Young, clinical psychologist. Ken Lin, community pharmacist. Winnie Lau, registered psychiatric nurse. Thank you to all of you to take time from your busy schedule to take part in the webinar. And also, let's, without further ado, we invite Dr. Thomas Ho. He's a very experienced family physician. He's been practicing for over 40 years.
Good morning, everybody. Good morning, everybody. Okay, so our topic, our theme for today is frailty. And Dr. Ho, you have served so many senior patients. So do you see many patients with frailty? Well, frailty, the Ministry of Health and the medical community pays a lot of attention to. So based on statistics in Canada, people who are 65 years plus, there are more than 600,000 people. So by 2023, it will be 2.5 million seniors with frailty. And then we need 7.5 million people to take care of them. So this is a big issue. So what is frailty? So frailty is not a disease. It's not like a heart disease. It is a health condition. It's the reduced functionality of the body. For example, people getting frail, and when there is a little bit disease or stress, and then people would feel sick, get ill, and then it's hard to get recover, and then the quality of life gets reduced, and it's hard for them to take care of themselves, and also cognition issues, and then the death rate is 2 to 3 times higher than their peers. So early detection, early intervention, early treatment, that would be very helpful. And also old age seniors, when are we talking about the same thing? No. When you get older, yes, it's you have more chances to get frail, but still we can see lots of people in their 70s and their 80s, they are quite strong and healthy, but then some are not. So some younger ones, they are frail, and some older ones, they are quite strong, quite energetic. Okay, so just now you talked about when you get older, it doesn't mean you get frail. So not all seniors will get to this stage. So any signs or any indicators, what are the signs so that we can detect? Yes, when we have to pay attention to any changes in our body, and also your family members and the caregivers also have to pay close attention to make sure to let the to inform the healthcare providers. For example, the signs you have less you lack of appetite, and you lose weight unintentionally, and also you easily get tired, or you recently you walk quite slower and easier to fall for multiple times, or so you used to be quite active and recently you're slow, you are less active and you don't go out that often, and then also your memories gets poor, you have to be reminded many times, and then you just forget what you just hear, and also your emotions, you are in low mood, and also in your daily life you are less independent, you rely more on other people's assistance. So we can early identification, and that would be great, very helpful. The symptoms, and we can let the doctors know, or the healthcare providers know that, so that we can make sure we have early intervention, early treatment. For example, you just use when you drink, you have coughs, and then you're quite sensitive to the drinking. Maybe it's your swallowing issue, and every time you drink, and then the water goes to the throat, and then you had aspiration, and that's so we have to go through swallowing assessment test. And another example is that a senior, when she gets up, and then it takes time, takes more time to get up, and then when you get up you are emotionless, and then when your hands and legs are like you you can think your movements are much slower. Is it Parkinson? You have to we can try to find out. And then another example is that a senior doesn't want to do anything, just sitting there, and then no appetite, poor quality of sleep, or that might be an early sign of depression. So these are the signs we have to pay attention to so that we can offer help. Yes. So just observation of their daily life activities to see whether there's family members and caregivers. You try to observe any signs of that, and then you can contact the health professionals. Yeah, and also, is that a sign of frailty or other chronic diseases affecting the body's functions? So if a family member notice a senior seems to be there are changes, they can observe some changes. So the medical community, how do they do the assessment? How to is there something we can do calculation when it comes to frailty? Well, frailty, you can say there's mild, moderate, or severe. There's a clinical frailty index from 1 to 9. 1 is you're quite energetic, quite fit. Yeah. And then when you go to 5 or 6, then the senior can go out alone, or to do banking, or take public transit, or can able to do self-management of the medications and some heavy household work, or another situation that doesn't want to go out and then rely on family members' help, like showers, going to bathrooms. They all need help, and also 3 meals a day they need help, and that's the reliance on other people, and all the way to you rely on other people on everything. So we have this frailty scale, and when the doctors and family doctors and geriatrician would do tests like blood tests or assessments, and then we have some tools to help us. For example, the mobility, we have this time up and go mobility assessment, to go a few steps and then you turn around, and then let's see how much time you take. And also your intelligence, we have a MMSE. That's a simplified intelligence test, and lots of questions, a total score of 30, like what's the day today, and then something to remember, and then to do some calculations, or to copy something, or to draw something, and then we can do the assessment to see the memory, and then you get a score like 15, that's moderate, and then 1 year later, half a year later, and then there's is it any progress, or maybe you'll get to 18 or to 10 points. So we use those tools to do the assessments. And also we have a multidiscipline, like a team, team members from different disciplines. We look at the medications, the pharmacists look at the medications, and then physiotherapists look at the physical activity. So there's a team to work on it. So the most important thing is that the family members and then or the patients themselves, when they have this, when you find out there's a possibility, they have to contact family doctors to see whether are you in that situation, in that condition, and then to seek help, and then to contact different departments to get help. So when it comes to managing frailty, patients with frailty, so what are the recommendations from doctors? How to help? Yes, management. First of all, seniors, they are getting frailer and frailer. So we well, we have to know what their wishes are. Like if they are not cannot make it that clear, then we can ask their family members, like whether they want to go through CPR or when the there's a heartbeat problem, and then the advantages and disadvantages, and also the goals of the care, and because you have to go to ICU, lots of tubes, and then they to maintain the breath. So I don't like it. I just want to be in my comfort zone. So we have to have that communication with the family members or with the patient, so that we know what their wishes are, that what their goals of care are. So then the team can have a better understanding of how to help the patient when you get older. So we have different ways of dealing with a patient. Like, for example, when you have diabetes and when you are younger, then your rate and then the assessment are good. But seniors, maybe we have less restrictions, maybe 8.5, that would be okay, 8.0, that's okay. And then make sure the blood sugar is at the appropriate level, and also taking into consideration the quality of life. So we have different goals for people with different ages. Yes. Medication. Yes, when it comes to medications, medication management is also very important, because when you get older, you take more medications, and so you have to try to simplify things. That would be better. Sometimes when you I'm so used to these all the medications, I don't have to go to see the doctors. But you know your body is changing, and then your functions, and then you have to, when it get to a certain point, some of the medications are not that appropriate, and then you have to review the medications, because the medication, they help us a lot, but then also they have the advantages and disadvantages. We have to review the medications at a certain age, and what's the ideal, what's the most effective. And so that's why we have to do the review to reassess everything. So the pharmacists can help us, and you also have the drug interaction issue. So interactions between drugs, we have to also pay attention to.
So it's very important as age changes, the medication and the use, and there would have to be changes. Yes, correct. It will not always be the same. There will be changes. Okay. Finally, so if at home one can't manage, then how can we help them? And this is a very practical issue with seniors as they getting more and more frail. They need more and more care sometimes, especially when they are incontinent in terms of the passing motion and peeing. Then it's very difficult for the caregiver. There's many resources in the community. Later on, we have a session. We will talk about many useful information will be provided, how to apply for assistance, where do you make inquiry for the worst case palliative care, and also they have that too. That's a social resources are very useful. Okay. Finally, any way to prevent? Of course, we have some tips. We have to try our best. First of all, like I said, we have to take care of ourselves. We have to see whether there's a lot of weight loss, and you have a blood pressure equipment. Check your blood pressure, and every now and then your blood sugar and cholesterol. Get the doctor to follow up on those. In terms of diets, of course, you must be average. Don't take too much junk food. Take fruits and vegetables and all whole grain, fish and tofu. You get a detailed description, and vitamin, you have to pay attention. Vitamin D is very helpful to many seniors for osteoporosis, and also prevent them from falling, and also helps increase our immunity, and also prevent diseases from invading. And B12, if it's too low, you have to supplement for the brain. All this would be very helpful. And the most important thing that I have to talk about is exercise. Exercise is very helpful to our health. Many seniors say that I'm aching all over, I have arthritis, I can't move. What's there to exercise? I just sit down, lie down, and watch TV. That's the best. That's incorrect, because as in the hospital, even if you lie in the hospital a few days, they will help you. They are afraid that your blood vessel will get congested, and if you lie down too long, you might get pneumonia. So one must move. If I say, if I'm like this, how can I move? Then I'm so weak. Even if you are in pain, you have to move. Actually, there are many things to help to reduce the pain, like Tylenol is safe, make you less painful, so that you can start moving, strengthen your muscles. Once you get back your health, everything gets better. Of course, exercise, there are many types of exercise. Everybody's exercise amount is different. Physiotherapists would teach you what's most suitable for you. So after a heart attack, they would be required to start exercising quickly. It's not like after your heart attack, you will lie down without moving. Once you're stable, you must start moving, not just sitting there. So exercise is you not smoke, also alcohol. Try to reduce alcohol intake, and also we have to cultivate some hobbies, some interests. Positive. Everything must be positive. Don't think like I'm old, whatever. I'll just sit here and they're waiting to die. No, don't use this kind of attitude. Dr. Young, psychologist, will talk about psychology and also depression in seniors. So we have to get old but not retire and stop, and we have to maintain our exercise, and also a regular physical examination, because a lot of people say, I don't have anything. Actually, after examination, you didn't know that you have. Without examination, one is unaware. So we have to treat every other condition when it's at an early stage. We're hoping to to get old and not frail, and not get frail before getting old. Okay, thank you, Dr. Ho, for describing in such detail all aspects. So those who are taking care of seniors at home, please pay more attention. We have many resources. I know people who are online, who are on site. You might feel that I want to copy down the resources, information, or the community resources. Please don't rush. When you are on site, you already have a booklet that has got all the community resources printed in your booklet. And people who are online, or friends online, we have a UPC code for you to scan, and you could get on to our website and also look at all the community resources. Don't worry, everyone. Okay, thank you, Dr. Ho. The next person, Dr. Ho, had talked about diets. We Chinese people like to eat, but seniors, when they get on in age, what should they eat that's suitable for them, that's got sufficient nutrition? What nutrition do they need? A lot of people think once you get old, you don't eat so much. I don't have a lot of activities. Actually, is this thinking correct? We are glad today to have Amy Yu, registered dietitian, to talk about seniors, healthy eating for older adults. How's everybody? I'm a registered dietitian, Amy Yu. Today I'm very happy to share with you a very important topic, that is healthy eating for our older adults. I've been a dietitian for so many years. A lot of senior friends come to me and ask me how can they eat healthy so that they can keep their energy. Today, I will share with everyone what I have in the clinics, and when I meet with all the seniors, the tips about healthy eating. Hopefully it will be helpful to you, or the senior that you take care of, and make them more healthy and increase their quality of life. I'm a registered dietitian. I'm also an educationist in diabetes. I help a lot of Chinese people in improving their diets. Today, the topics that we learned, there are three objectives that are more important. The first one is the importance of nutritional needs for seniors. Secondly, how to plan a healthy diet for seniors. Third is the practical tips in meal preparation for seniors. So today, the webinar is about 20-odd minutes. I will share with everyone the above what I talked about, the objectives that I talked about. Hopefully, after you learned, you will do it for your own dieting health, or as a caregiver, you would look at and know more about seniors' dietary needs and prepare a nutritious meal for them. First of all, we can look at the nutritional needs for older adults. Actually, there are three aspects. First, whether there's sufficient nutrition, then it would promote seniors' health, and also it can prevent malnutrition. And thirdly, it would make seniors independent, have independent living, or increase their functionality. And also self-management, improve the quality of life. And we will start look at all the three aspects and see how they will meet the seniors' need and meet their nutritional needs. First, we will look at the factors affect proper diet, eating, and management strategy for seniors. There are three areas. First is physical limitations and challenges. Secondly is chronic health conditions. Third, social and psychological factors. let me tell you in detail the physical limitations and challenges. Sometimes the seniors have limitations compared to when they were younger. Maybe it's reduced when it comes to grocery shopping or preparing meals. Perhaps it would be a bit harder for them, and sometimes it may mean that as they get older, they may not drive, and then going to the supermarket to do grocery shopping, it might be a challenge in itself. So a lot of Chinese senior friends, they like to eat some new vegetables or fruits or meat. Actually, after coming to Canada, you can consider changing to local purchase method. Sometimes we buy a little bit more and put in the freezer, in the fridge, so that you don't need to go grocery shopping all the time. And secondly, sometimes there's some chronic health conditions. For instance, if there's chronic condition, diabetes, heart disease, or kidney disease, these chronic diseases will make the dietary needs. It will have an impact. For instance, if there's a heart disease, so in terms of taking sodium and salt, you've got to pay attention. When it comes to cooking or meal preparation, attention must be paid to not to use too much processed food and reduce meat and also food, and also social and psychological factors. Social and psychological factors, how do they affect the seniors? Sometimes the seniors, when they are, say, retired, the social circle gets smaller, so that it would reduce the contact with the outside world. The friends will get less. Sometimes if they are always eating by themselves, it would affect the appetite and the desire to eat. So if family members, they have seniors and seniors living on their own, maybe you should have more meals with them, or more let them have more contact with other friends to increase the social circle.
So when you are preparing for older adults, preparing meals for older adults, well, you can refer to this online menu that's from the Canadian Diet Guide, and you can see half of it's fruits and vegetables, and then different colors. And we always recommend variety is quite important. Like you have green, red, white, and orange, black, all different colors. So varieties, the more varieties, the better, so that you give the seniors different nutrients and vitamins and minerals. And this healthy plate, you also see 1/4 is protein. Like you make sure you have protein-rich food, like lean meat and fish, seafood, tofu, and nuts and seeds. These are soys. These are good stuff. And also, if you drink milk and dairy products, cheese, they are good choices. And the other 1/4 is whole grain foods. Whole grain includes like the rice, different kinds of and noodles, and you can try different flours, noodles made from different flours, and also the size of the plate and how much do you eat. It's up to different individuals. It's has to do with the person's weight and height, and also physical activity. So you can ask the a registered dietitian to design this your diet for you, your preferences, any so that everything gets custom made. Maybe you reduce the amount of this and then increase the amount of that. Maybe less protein. Then, but you still have to make sure you have sufficient protein. So that is why we need a registered dietitian to design your 3 meals. Now I have the top 10 tips when it comes to your healthy eating for seniors and techniques. The first one, tip number 1, is you have to consider your dietary needs. Just now we talked about why we begin first with the seniors' personal needs, dietary needs. We have to go from there because everything starts there to make sure things are customized. For example, now you have the internet, you just go online to find some tips, health-related tips. But I have to make sure, you have to make sure is that suitable for you, because tips online, they are the information online, they are not necessarily reliable. So make sure you seek help from your registered dietitian, your also registered pharmacists to make sure are there any conflicts between the medications and what you eat. For example, when you have a certain disease, you try to avoid a certain kind of food, like a certain kind of fruits. So this is the where you have to pay attention to. And other than that, the tip number 2 is that you have to focus on nutrient-dense foods. What do we mean by nutrient-dense foods? That is, you don't need that much of that foods, but then they can give you sufficient enough nutrition. For example, like soybean milk or black sesame food, or whole grain food, whole grain breads, or lean meats with rich protein. They are nutrient-dense foods. Seniors have small appetite, so you try to find nutrient-dense foods. That's very important for seniors. Tip number 3, you try to portion control. It's not, we don't mean the less the better. What we're trying to say is that you try to make sure the appropriate amount for a senior. For example, when you have blood sugar issue, you still need the like things like rice and flour products, but you make sure it's like a fist size. That's the size for you, and then go together with, just now we mentioned, nutrient-dense foods, protein-rich, and it's like 15 to 20 grams. How much is 15 to 20 grams? It's 3 ounces, like 3 ounces of cooked meat. That's 20 grams. So just now what I told you, that the amount that would be ideal. So you make sure it's balanced in your 3 meals. But when you don't have that much appetite, you can distribute among the 3 meals. That would be good for their intake of the nutrients. And if the family members can reduce your household chores. Tip number 4, include protein. Make sure you include protein, because everybody needs protein. So protein-rich, for example, eggs, soy products, milk, cheese, lean meats and then fish, seafood, they are good sources of protein. And then soybean products and also nuts, they all have rich protein. So you try to make sure you have intake of different sources of protein. That's a good advice. And then make sure you are muscle strength. So you need the intake of protein to strengthen your muscles. So make sure you have different kinds of different sources of protein intake. Tip number 5, to make sure you offer variety. Why? Because number 1, seniors, they want to try different varieties, right? You don't want to repeat the same thing every day. That will be quite boring. So you try to come up with the different varieties of foods. Then their taste buds, they want to try some heavy like tastes, like spices or natural foods materials to make the to strengthen the flavors. Then these things can strengthen the tastes of the foods. These are natural things. They are quite good choices. And varieties also means that the nutrition comes from different sources. And so varieties is a good idea. And then tip number 6, you have to consider texture. There's 2 reasons there. Number 1, because the seniors, they don't have strong teeth, so it's hard for them to chew. So you make sure their teeth health. And when you have cavities, you have to go to see your dentist, and then get help from your dentist to make sure you can chew. And also the other reason, it is the some of the foods are hard to chew and swallow. So make sure the foods, the texture, you make sure the texture of the foods is suitable for the seniors in your home. And then also to avoid the risk of when the risks relating to swallowing, and also good for their digestion. And now it's in June. It's getting hotter and hotter. Summer is here. And then tip number 7 is to make sure you try to prevent dehydration, to drink more, because the seniors, they don't feel thirsty, they forget to drink. So how much do we drink? It's not necessarily 8 glasses, because it's quite individualized. When you go out, when you sweat a lot, maybe you go more than 8 glasses. But if you stay at home and then you don't sweat a lot, you also try to make sure 6 glasses or 7 glasses. If you don't want to drink, what can you do? You can drink soups or Chinese teas, not that strong, and then like soybean milk, and these can make sure you have enough hydration. Make sure you choose drinks that you like. Sugar doesn't contain too much sugar, like soda water, and some drinks that with sugar. Some fruit juices has too much sugar, so try to use sugar. You go without sugar, the soybean milk without sugar. And tip number 8, to minimize processed foods. Processed foods include like canned meats that would lead to high blood pressure and not good for your kidneys. So to make things convenient, you, for example, salmon fish, tuna fish, canned fish, and also canned beans you can store at home. And make sure you have to you use water to get away the bubbles. Then you can just eat it. Tip number 9 is be mindful of food safety. Because seniors people, they don't want to waste food. When they cook too much, when they cannot eat the food, they want to put it in the refrigerator because they don't want to waste the food. And in the fridge for a period of time, but you have to make sure you can just eat it like in a week, right? It's make sure you just eat it in two days, and then when you recook it, make sure the temperature is high enough, and not just use the microwave just for 1 minute, and then if you recook it, don't just put it back into the refrigerator again, because seniors, the immune system doesn't work that well, so you have to avoid the food poisoning. So make sure you use make sure in proper way to keep the food in the refrigerator. And tip number 10, that's my last tip, is you have to consider convenience, because when you live in Canada, and Canada has vast territory, so people who don't drive, you can think about the idea of asking the supermarket to deliver your foods, because supermarkets, they offer this kind of services. And if you shop online, it's quite easy. You can do it, or asking your children, your relatives to help do grocery shopping, and then something you can store at home, and make sure before the expiry dates you eat them all. And then your kitchen can store some dried foods and some and make sure
You can keep for a longer time, and for instance, a week you can buy once every week. You can consider the convenience is also would be more flexibility for seniors preparing the daily meal. If there's any problem, there are a few revenues. You can ask the references as follows. Hopefully you have time to look a lot of the articles for seniors eating health, and there's also written in Chinese. That's the 2020 edited, so you can go and refer to them in terms of community resources. If there's any detailed questions that you would like to ask, you can get to HealthLink BC 811, the government's hotline. There will be pharmacists and nurses and physiotherapists. They could answer your questions, and also some Chinese articles. I have also listed them here. Let me repeat. If you want to ask for help, first you can call 811, the BC government's health hotline. It's free, 811. If you want to look for more private dietitians, and if your MSP, your medical insurance, you have enhanced insurance, you can go to the website. They have the dietitian's website. You can look for dietitians that know your culture and that can speak your language. They will be of help to you. Thank you, everybody, for participating in this webinar. Wish you good health. Bye. Thank you very much, Amy, dietitian, giving us so much detailed description. And as we age, nutritional diet is very important to us, not only seniors. The dietitian gave very good suggestions. We had a topic on diet, and Dr. Ho also mentioned in terms of seniors, maybe they have chronic diseases or when they are more frail. Apart from paying attention to diet, they have to have enough nutrition. We have to be careful not to let us fall, because after a fall, it would affect our overall health, our function, and movement. Today, we are glad to have Wendy Lam, a registered occupational therapist, to talk about fall prevention and home safety in seniors. I know she's got a lot of information. Wendy has got many questions for everyone, but because of time constraint, we cannot do the polling individually. When she shows you the questions, you can think about her question, give it a thought, and see how you're going to be answering. People who are on site, you have already been provided with the questions. Okay, thank you, Wendy. Thank you for taking time to talk to us in this webinar. Thank you, everybody. Today, we'll talk about home safety and fall prevention in seniors. First, I have to thank iCON for re-inviting us back. And also, today I'm hoping to reach this objective on this webinar, to understand the medical, physical, and psychological risk factors of falls, and also to identify common fall hazards, and also look at any home modification to improve safety. And once you fall, how do you deal with it? The World Health Organization says fall is defined as an event which results in a person coming to rest inevitably on the ground or floor or other lower level. It could be more serious and less serious. Let's look at the poll. Just give it some thought. In Canada, an older adult falls about every 30 minutes. Is it true or not, or false? And in terms of falls, give it a thought. What's the percentage would cause hip fracture? Adults age 65 and more should be active for how many minutes each week? How many minutes of exercise? Majority of residential falls among older adults are caused by hazards in the home. Is it true or false? Physical activity has been shown to be effective in reducing an individual's risk for a fall. Is it true or false? Let's think about it, see whether there are any answers for you. Okay. Actually, it's true. In Canada, seniors getting injured mostly is because of a fall. Actually, 20 to 30%, they would have fallen in a year. In terms of falls, about 95% would cause hip fractures or other more serious hospitalization. About 40% will have to be hospitalized or go to a senior's home. And 30% would increase frailty or may even be dead. Actually, is pretty high. 83% in the community would have falls, and only 70% happen in the facility-based care. So this could be serious or maybe less serious. In other words, every 30 minutes there will be one person falling, going to a hospital. Actually, it's pretty high. That's good news. Is falls that are preventable. Actually, we have to understand what are the risks. The main, you have to think about your history, your health history, past history of falls in the past. In terms of age, whether you're getting more advanced and activities of daily living, whether any difficulty in movement, also in terms of your medical and psychiatric comorbidity or weakness and gait and balance difficulties, in terms of joints, also gout or stiff joints. It might affect movement, visual impairment, or mood impairment, or even physical in terms of daily living activities. Ability to move might be reduced, or incontinence, more serious issues. Actually, there are many physical and also environmental, social, economic, behavioral, and also functional changes. All these all added up would add on to the risk. In terms of biological medication, later on the pharmacist would explain detail. Some drugs would affect balance or muscle decrease, also make you dizzy, or mood change, also cognitive changes. All these would add on to frailty risk and fall risk. And also you can look the health and also the cardio respiratory and also muscle skeletal, and all this added up would increase the risk. A lot of these maybe you can't change, but some of the behavioral ones, or maybe functional change, maybe you can change in terms of movement. In terms of function, there might be limitation, and also urinary and bowel might need help. In terms of behavioral, some seniors tell us, actually, I'm afraid to fall. Actually, the more you're afraid, the easier you fall. Some seniors might, in terms of the communication, they have difficulty. They can't say that they want to go to the washroom, or perhaps they have limitation in their movement, and they are not paying attention to safety. They overestimated themselves and may add on to the risk. And also other factors like misuse of medication, or using assistive devices that are not appropriate, or wear not appropriate footwear or clothing, or poor nutrition. And some seniors, they are afraid to go to the washroom at night, so they don't drink. Actually, this would add on the risk, because dehydration would cause dizziness. So you have to think about it and pay more attention. Actually, socioeconomic risk factor, also the senior must pay attention. Maybe the living condition is poor, no friends or family to help, no one taking care. So they may have to go out. In terms of communication, is not convenient. And in Canada, maybe environmental, there's rain and snow, so the risk might be increased going out for grocery shopping. Maybe at home, in terms of environmental, maybe there's some cluttered stuff, no railing, and the floor is not tidy up. So this might add on to the risk. Environmental, there are other factors, wet floor, or something spilled and is not cleared right away, or maybe some other things that's not tidy up. With so many risks, how do we deal with them? How to prevent? Actually, BC There are 4 pillars of for prevention. First is exercise, second is medication, and also home safety and vision. First, we talk about exercise. Actually, exercise is the biggest, the most effective way to prevent falls. You have to take part in this safety training courses to train your muscle function and balance. If you don't know, you can call 811 to find out what activities in the community might be helpful. Also, there might be some assessors in the community might do a course for you that suits your purpose. People who like to go online, actually you can do exercise at home. Fraser Valley and so Vancouver, they have suggested that you do this living at home exercises. You just sit down or you stand up. You can do some simple exercises at home in your comfortable environment, and with some tea you can do the exercise, and you can go to YouTube to check later. Apart from this cardio, and you have also can do strength training, walking and balance exercise. Later on, the physiotherapist will introduce you to 65 and above. Every week you should do 150 hours. And 150 minutes. Actually, somebody might say, "Oh, I don't do exercise. 150 minutes a week is a lot." Actually, you can split. You can do maybe 10 minutes at a time, morning, noon, and night. And when you add up all together, very soon you'll get the 150 minutes. A lot of people tell me I don't do exercise other times. To redo it actually is boring. Actually, you can try. You can try to do the osteofit community plans, or do some balance, yoga, dance, and tennis, other exercise. First, you can communicate with other people, socialize with other people, and also for your keep fit is a good way.
Now let's move on to actually a pharmacist will talk about medications. So let's move on to home safety. So pay attention to your environment, any clutter, anything blocking your way, any improvements in your home. For example, in the bathroom, some rails installed, kind of things. And also look at your home. Yeah, make things more organized. You can see on your left and on your right. Look at the pictures. Which one has more risks? Of course, seniors, they want to keep things. They don't want to waste things. Of course, you can try to anything you can get rid of or donate them. And see on your left, it's hard to walk, right? To walk through. And then you get easily to get fall. So to make sure you organize things in your home. And next we have a video. You can see there are some tips, and watch that video, please. So these are the common things that I do. Yeah, like these cooking utensils, make sure they are just easy to reach. Then you don't have to reach too much or bend too much. And also the cupboards, it's easier to get things, so make sure the heavy things goes in the lower cupboards, and the light things are in the upper cupboards. And those that are you don't use that often, you can move them away so that you have more space. And in the lower cupboards, you can move some things. which you often use to the upper cupboard, then it's easier for you to get them. Or something you eat quite often, then you also move up to the counter so that it's easy for you to reach them. And also, you have some bulk food, or you have big bags of, for example, cereals or oatmeals. You try to store them in jars on the counter. And things you occasionally use, you can just put them here on top of the cupboard, and you can use a reacher, a long-handled reacher, to reach things, or you use a sturdy footstool for you to get things. And also, if you cannot reach something safely, you make sure you ask for help. The lower cupboard, when you want to find something, you have to hold on to your countertop and bend your knees, not your back. If we want to renovate your kitchen, you make sure you can install things like this. And when you want to make the kitchen clean, you try to not to use wax and other similar stuff, and also remove any water and avoid bending. Use long spoon, and also the rugs, remove them, because it's easier for you to get fall. And then also the cleaning products, make sure they are within your reach. And then make sure you have firm soles with closed toe. And also, you need more light. You can try to improve lighting. And whenever you go to the get into the kitchen, the lights can be automatically turned on. And consider kitchen layout, and put something just on top of the kitchen table. If you have your cane, and then do you have enough room, space for you to turn around? And also kitchen door, and make sure it's always accessible, and to tidy up things in your kitchen, and to avoid your fall risks, and to prevent your falls. And then you start with your daily living. So that's the video with all the tips, and then something you can learn from. And also in the kitchen, you can also make improvements. Just now we mentioned the rails in your bathroom. Maybe we can use the towel rack. That's not a good idea, because these racks, it's cannot hold on. It's hard for them using the rakes to carry the weight. So how do we do that? So this vertical rail, it's 18 inches long, and then it can be suitable for people with different heights. Don't put it too high or too low. And then once it's installed, you can safely get into your tub. When you're in the tub, when you want to get up, it's not that easy. When there's a rail, it's easier for you to get up. So you have a rail there, and then that goes diagonally, and then it's easier for you to hold on to. And then once you have the rail installed, you can use that to help you get out of the tub. And then with that rail, you can also do shower. Make sure you have a small rug there, and then to avoid the soap bubbles. And then with the rails, you can make sure you have a safer home to avoid the fall risks. And then occupational therapists like me can give you lots of advice to help you make sure how you prevent falls. So make sure you try those prevention measures to make sure your home is safe. So that's a lot. You have a lot of ways to ensure a safer home. And you can also use the bath lifts or transfer benches, some operated by power. And then also bedside, you can also use bedside rail, and also there's a lift chair to help you get up. And also in your car, you can try your handy bar in your car. And then walking aids, you have the four-wheel walker, and then you also canes and also walking poles. So you can ask help from your registered occupationalist. It can also borrow from the Red Cross. You can call 811 to make your inquiries. Other than that, there's hip protectors. It's like pants. You just put it on, and then when you do have a fall, it can give you more protection to reduce your risks of hip fractures. And when it comes to shoes, well, usually you'll go to dollar store to buy some shoes, but they're not that good. And you make sure when you buy shoes, make sure the shoes have the top, have the sole, and also make sure the heel is ideal, and also with the padding. And also one of the four pillars is the vision. Lots of disorders, visual disorders. You can see these images, and then people with diabetes, they have these images. You can imagine what they see when they don't see clearly, so it's easier for them to fall. So make sure you use eye drops. You use your eye drops correctly. You make sure you have clean glasses, and then to make sure you have more lighting, and you can see the you can make things easier to see, like this the stairs. You can see the sharp contrasts. Use some different colors, and then you can create the contrasts for you to easy to see things. And also go to your eye doctor more often to go with your screening. And also you can also install Lifeline at home. This Lifeline is 24/7 service. Once you fall at home, or no one is at home, you can just press the button, and then it has GPS, and it has the sensor, and then you can just get help right away. You can make phone calls to do your inquiries. And once you do fall, how can you safely get up? First of all, you have to make sure, do you get injured, any pains? And then once you are safe, you try to get up. So let's watch this video.
嗱，如果真係冇受傷到咧，咁樣覺得
So if you make sure you are not injured, and then you can slowly get up, and you are like this, and then your hands and legs are on the floor, and make sure you find a secure place, a sofa, a chair, and then you use your hands to support, and then you find the strongest leg to get up, and then slowly you turn around, and then you can sit fully in the couch. Once you are calm enough, and then you try to contact your family doctor about your fall, because you take into consideration your future risks. So you need an assessment. And then next slide. Yeah, there are lots of community resources available. Fraser Health has a fall prevention clinic. You can, in the community, they can do the assessment, and also there's a pharmacist and a occupational therapist, and then they can form a team to work on the assessment to see your risks and give you some data, and then your physiotherapist then can come up with a plan for you to prevent falls at home. And also, and Fraser Health has a guide, education catalog that's independent living, your guide to independent living. And also there's this checklist. You can answer those questions. And then if your score is above 4, then you have more risks. And other community resources, lots of resources. You can find those resources on the iCON website. And thank you for the opportunity for me to share with you how to prevent your falls. You start with your daily living. Thank you.
Thank you, Wendy, for being so detailed. I know there's a lot of resources, a lot of aspects. Everybody got to pay attention. We have learned a little today. Some tips. Wendy has talked about very quickly, taught us. Okay, following this, we will have 2 physiotherapists. Wendy mentioned earlier the most important fall prevention is to do exercise. Today we are glad to have 2, Nicole and Emily. Emily Pat and Nicole Tai, they are both physiotherapists, to go through with us as to how we can strengthen our body and prevent frailty. Hi, everybody. We'll talk about exercise. Our objective today is to talk about, yes, we will talk about the advantage of exercise. We have to, let's introduce ourselves. Okay. Okay. Maybe we had some slides. We had our pictures, but you can see. I'll talk about ourselves. I'm Nicole. I'm a registered physiotherapist and also a registered needling expert, and I am helping people to do the muscular injury and training. Hi, I'm Emily Pat, and also a registered physiotherapist in Canada. Okay. I said so earlier, what's the advantage of doing exercise, and how do you prepare the exercise, and how to prevent injury when exercising, and also using what assistive devices to help us do some exercise. Okay. I want to ask you, do you have any low back pain or shoulder pain or neck pain, knee pain, stuff like that? Maybe you have, or maybe you have some high blood pressure, cholesterol, diabetes, respiratory disease, or osteoporosis. Actually, seniors have a lot of different conditions, or also bone issues. A lot of times the doctors say doing exercise is good, but how to do exercise safely and how to be healthier. Actually, when we do exercise, do regularly is very good. It would help seniors in many areas to improve. Doing exercise, apart from improving physically, it would decrease stress. It would also improve our general health, improve circulation, increase our immunity so that we don't get cough and cold so easily. And some people feel that actually exercise could bring about weight loss. That would also reduce stress for our joints. As we age, actually there are a lot of changes in terms of bone. Maybe it would get age and also osteoporosis, and our heart health, also cardiovascular. There might be some changes and maybe some stiff and also not meaning the index or immune health may decrease. Actually, in many areas we have to improve. How to prepare to do age-appropriate exercise. In terms of exercise, there are four major ones. One is endurance, aerobic, cardio. Second one is strength training. Third is balance training. And lastly is flexibility. Actually, what is aerobic cardio? Actually, is something that helps with our cardiovascular exercise health. When we're doing, you can feel that your heart rate goes up, and the intensity is from moderate. That means when you're exercising, you can still chat, maybe with some difficulty, to vigorous. That means when you can't chat, you're panting, some difficulty, you can't talk. So between moderate and vigorous, that's good. And every week you have to do 150 minutes. You can split into several days. That's our objective. And when you do exercise, actually it's good for your cardiovascular and lung. Is very good. And when we do our house chores and going upstairs and downstairs is very good. It's very important. That one is muscle strengthening, and there are two types. One is a muscular strength and muscular endurance. What is the muscle power? When you do some weight, you can raise 6 to 10 times before you sit down. Muscle endurance, lighter weight, but you can raise more. Both of them would do the muscular training, because sometimes we have to use our muscle strength and inner strength, and you do 2-3 times a week is good. I could do pushing, pulling, and reaching. You use major muscles, and sometimes the chest or your arm muscle is all important. Actually, when we have healthy muscles, when we do something that we like, landscaping, looking after grandkids is simpler, and also it helps with our bone health. The third one is balance. In terms of balance training, actually is very important for seniors. You can do it every day, and you challenge yourself. Standing on one leg or holding furniture or table to stand on one leg, increasing our balance, stability. Once we are well balanced, it's not so easy to fall. And lastly is flexibility. Actually, our flexibility, we can do it every day. We can do some bending, reaching, so make our stature and our lower limbs could be more flexible when we carry things or do something movement like housework is harder to get pulled or strained. And if every time, if you have friends who have not started exercising or seniors, you can try this 8-week walking program. Actually, in the 8 weeks, maybe 1 week you do 3 times. Each time you do 15 minutes walking and slowly. And every week you can increase the number of times or increase the time, but not to increase both at the same time. Because if you do that, it would be hard for your physically, and then maybe you can't finish 8 weeks and you say not to do anymore. You can start with 15 minutes 3 times a week, and then increase to 4 times a week, and then you increase the length, increase to 20 minutes 3 times a week, 4 times a week, and then you can see there's a 8-week program. There's a start. Apart from the one exercise, actually you can do other Tai Chi, Qigong, or tower dance. It's very good to do. Or like chair yoga is suitable for your seniors too. Okay. Doing exercise to seniors is good, but the most importantly, we have to make sure when we are exercising, we don't get injured. And then I'll tell you, apart from exercising, you can be safe too. First of all, you have to remember before doing exercise, you have to do some warm-up, and after exercise, you have to cool down. Like for pulling exercise, or you move your legs, you will warm up your body. Not so easy to get injured, and also you have to be careful. Avoid extreme weather. If it's too hot or too cold, don't do exercise. Pick some warm time, not raining. Do some outdoor exercise. And you do indoor is safe. And when you do exercise, you have to drink water to hydrate yourself. Otherwise, when you perspire too much, you might be dizzy, or you get sunstroke, or you have to eat some carbohydrate like fruit juice or Gatorade or cookies to supplement. Actually, there are some indexes for you to check to see your exercise extent, whether it's proper. That is rating of perceived exertion. 10 is too much exertion, like you almost faint. We don't wish you go to that. So our aim is between 5 and 7. When you're exercising, you can feel that it's a little hard. You are a little tired. That's enough extent. And also, when you have to know how to rate your heart rate, we can put 2 fingers on my wrist, close to my thumb, and you can feel the pulse and look at the watch. In 15 minutes, what's the rate? And you time that with 4. That would be your heart rate in a minute. Our objective is use this formula: 220 minus your age and minus your stationary heart rate. Let's say if you're 65 and ordinarily when you're sitting down is 60, then you 220 minus 65 minus 60, and that's your reserve heart rate is 95. Okay. And this is very simple talk test. Different levels. When it's light, you can very easily sing and talk. Moderate, you can talk, but it's a little tired, you can't sing. and when it's vigorous, you don't have enough air to talk and sing. As a senior, I suggest you do the moderate level. That's good enough. You can exercise and chat, but talk, but can't sing. That's the appropriate level. Okay. As for seniors, the legs may be not so strong. You can see some seniors, they use assistive device to help. Actually, different types of devices, depending your doctor and recommendation. We can see which assistive devices help you, like some canes, walker, for wheel walker with wheel the rollator, or also wheelchair.
So a brief introduction to these walkers and their advantages. When you have the walkers, some have wheels, some don't, and then up to your therapist to decide which one is better. So this one provides two-sided walking support. When you don't have the strength, you use these walker to help you. When you walk, you use this walker. Then if you have the wheels one, and then you can just push it forward, and then you just push. If you just push and fall, just push and walk, it's easier for you to fall. If you don't have that much strength in your legs, then you can try a walking cane. And this is a single-sided walking support. And if you're weaker in the left side, and you just have the walker on your right-hand side, and then other people won't bump into you, and that's safer for you to walk. So, and let's do some exercise now together. So let's give you a demo how to do exercise at home, and we don't need that too much equipment, just some things that you have at home. Can you see us? Yes, you can see us, right? And for example, at home, you can get 2 water bottles, and then let's do like develop our strength in the arms. You can do things like this, up and down. So we are developing the muscle there. And we can also try to go like this. Yeah. Like this. And you can pause for 5 seconds, and then 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And then that's we use bottles to work on our arms. And now our legs and weights, you can get some support from a piece of furniture, and then you go slowly like that, and then you squat, and then you get up straight, and make sure you have a piece of furniture to give you the support. Don't use the chairs with wheels. You go like that, and also you can sit on a chair, and that's also something you can do to develop your strength in your legs. You sit like this, and then when you get up, you just lean forward, and then you get up, and then you lean forward, and then you sit down, and then one more time you lean forward, you get up, and then you lean forward, you sit down. When you need some support, you can use the arm support. And now we can do it together. And then try something else. You find some support like a piece of furniture, and then you look at the position of your feet. Your feet goes like that, and you are now strengthening your lower legs. See, up, down, up, down. Yeah, so developing stronger lower legs. And then if you are confident enough, you can try this balance exercise again with some support from a piece of furniture, and then lift your one feet. And then if you are confident, and then you can try, you go without the support. Otherwise, you can rely on the support, and you lift one foot, 1, 2, 3, and then you put it back. The other side, do it the same thing. 1, 2, 3 seconds, and then put it back. Now, we are still standing, but this time we can go like you're marching. You go up and down, like you're marching. So you can do repeat this for 10 times. Marching. So this is what we are working on your upper legs, and then make it more challenging. Let's do. If you are confident, you can go like this. Yeah, your right hand, your left knee, your left knee, your right hand. If you're not that confident, you can sit on a chair, and you can make your left hand right knee, right hand left knee. Now we are working on your hip muscles, like that. So are you okay with this exercise? And now let's try one more. It's a balance exercise. We can stand up, and then we go it's like you're dancing. You go to the left, your left side, your right side. You're just walking, yeah, sideways. Good exercise. Do you enjoy this exercise? And make sure when you do exercise at home, make sure it's safe and there are family members beside you. Yeah, don't do too much that it's too challenging. Safety is number one, and then make sure it's safety and health. And thank you so much. Thank you, Nicole and Emily, for your demos. And I guess we can benefit a lot from your demos. So exercise is very important, but also make sure it's safe, and then you go gradually, not in a haste. And when we age, when you have the chronic diseases, you have to take it slow. Yeah, don't rush. Make sure you don't just always sit still. Try to make sure you have physical activity every day. That will be good for your strength in your bones. Okay, our next guest speaker, let's talk about depression in elderly. and we have our Dr. Tigerson Young, registered psychologist, to talk about depression in seniors. Hi, everybody, and thank you, iCON, giving me this opportunity to see everybody again and to share with you some ideas. And let me, we haven't met before, but some of you we have met before, some new faces there. So thank you, iCON, for holding this event. And today, let's talk about some frailty, and then let's, from this psychology perspective, to look at frailty from a psychologist point of view. So what's on the agenda? Let's talk about how to recognize signs of depression in seniors, and also especially depression, the effects, and how to identify activities to keep us connected and others, how to deal with depression in frailty. And let's begin with a question. So we are now in 2024, and what's the population? What's the world population in 2024? First of all, 8 million, and you have all the numbers there, 1, 2, 3, 4, 5. So which one is the correct one? So what's your guess? Oh, wow. And now we have 8,000 million people in January 2024, lost people in India and China. And India will reach 1.6, and China will reach 1.4 billion people. And what about 65 people who are 65 years or older? So you look at the percentage, so it's 10% and all the way to 16% in 2050. So that's equivalent to, it's like, so we have senior people and young people, and then they are more or less sharing the same percentage. So 65 plus ages, where are they from? The sources of people. So in the 1980s, mostly from the Western countries, like countries in Europe and American, and now it's more the Asian countries, like 65 older people. They are mostly from Hong Kong, and then Korea, Japan, Taiwan, and Singapore. So mostly from Asian countries. And if we look at people who are 80 years old or older, and growing fastest is from 2021 to 2050. You can see the number 1.6 billion in 2050, and we are still quite young if compared with that. And life expectancy, this is the world trends in 200 years ago, in the 70s and 200 years ago, and the life expectancy is just 30, 40 years old. And now, in the 21st century, our life expectancy is almost like 80 years old. So it doubled the age 200 years ago. And if we look at Canada, our average life expectancy is 81 years old in 2022.
We know men shorter a little bit than women. In the last few years, we have shrunk a little bit from 2021 at 83 to 81.3. So it's a little bit less, not too much. maybe it's got to do with COVID, perhaps it's more or less to do with COVID, with aging. Some physical disease corresponding to age also increased, like in 2021. In U.S., they selected 10 major diseases: high blood pressure, high cholesterol, diabetes, and arthritis. We're well aware of that. We have heard a lot, but one of which has got to do with psychology. What is it? It's depression. Okay. It's 10 major diseases. Is one of them. Okay, really speaking, we all have up and down moods, right? Actually, what is depression? And depression is slightly different from our high and low mood. Say where there's a natural disaster, we might have depression is very normal, right? So clinically, the depression we see is slightly different. And today we learn a lot information about frailty. We also understand actually frailty itself is not a disease, is not heart disease or arthritis, it's a condition. And this biological condition has got to do with our mental state. So one of that can make that change is our mood health. Is what we call depression. Of course, like we said earlier, everybody has got up and low mood, and also depressed times. Sometimes maybe it's got to do with the outside environment, natural disaster. So this kind of condition with this kind of change in mood actually is a very normal reaction. Actually, nobody told me. Say for instance, after my car accident, I am very happy. I'm very elated after I got collided into. Nobody is like that, right? So clinically, this depression, you can say that is slightly different with the normal reaction. Clinical depression is when your mood change is more than the ordinary person's reaction, and also in terms of timing is maintained a certain period of time, unable to be adjusted to swing back. So it's more than the natural reaction. It's no longer just a natural reaction. In terms of depression, actually it's quite common. Clinically, patients about 25 to 50 clinical patient, they have that depression. So between 2 to 4, amongst 2 to 4, there's one. Females have double that amount. So are you saying more female depressed? No, may not be so. Maybe the male people, in terms of their presentation, is slightly different. You see, we male, we don't hardly talk to people about our moods and go see a doctor. Maybe it's because of that. We won't know whether the male people have less episode of depression, right? And also actually started from teenager to in 20s is a peak. Depression can be you can look at it as a chronic angle. Chronic means that the condition has been around for a certain period of time, at least 6 months or more, and is not improved. Then we call it a chronic condition. And later on, we will look at it in more details. Okay, in 2021, depression newsletter, there's research issues in the country. About 20% have got this problem. That means in domestically, in terms of senior people, actually, it's got to do similar to the Western world. 1 in every 4 to 5. What are the causes of depression? You ask. Actually, there are 2 origin. One is nature. One is nurture. Maybe nature has got to do with some chemical in our brain. in our chemical, in our brain, there's some delivery substance. When it's imbalanced, then the theory is because it's imbalanced, so it causes our mood to change. In our brain structure, it may be the cause for us to have depression. For instance, say the cortical thickness, actually the thickness when it's different, our mood, the reaction perhaps is different. We realize if the thickness is more, the episode seriousness may be less. So it's inverse corresponding. So it may cause us to have some mood change. And genetic is maybe another factor. Some research found out that if the parents have depression, then the children may also have depression. The risk may be higher by 3 to 5 times. And the episode may start earlier, and the seriousness may be more, and also the reaction to treatment may not be so good. And nurture, in terms of nurture, what factors are there? We've heard that iCON, people who have heard iCON, they heard about stress factor. We know that stress is very closely related to our mood. When we are under stress, our body will be naturally have some reaction. One of that is for your body to release to cortisol, and that would help us, our cortex. It would give us more energy to deal with the outside stress. Clinically, actually, we realize when we have long-term stress, perhaps it may have serious impact on us physically if we are affected by cortex long-term. We realize in some animal, the brain, what will happen, they will shrink. The cells might shrink also. You may say those are little lab mouses. Mice, are they comparable to people? We don't know, so we can't just give long-term stress to people. We can see from the rat mice model, we can see that actually we can see clinically there's some serious depression. We can't go through them all. Actually, we will talk about the more common one is major depression. In other words, it means that it's not general, it's not common, caused by the outer factors, because that's a very normal reaction. When something happened, after something happened, our symptom may get more than some other people, and it lasts longer than other people. Actually, depressive symptoms have different. If you have in 2 weeks 5 major symptoms, you can call it urgent depression. What are the symptoms? There are different types. For instance, loss of appetite, sleep disturbance, loss of concentration, agitation, low mood, or even you think about harming yourself. As long as you have 5 or more of that symptoms, or at least, and they around for 2 weeks or more, you can bounce back. That will be symptoms of depression. If you ask, then what can I do? If I can only do one thing, what should I do? Then my suggestion is you must adjust your sleep. When your sleep is, your lack of sleep, or the quality is not good, your body cannot recover the normal range. So one of them that you can change the frailty state is when you to look for a way to change the quality and duration of sleep. You have to learn. If the bed is only for bed, don't watch movies or think of things or eat on your bed or worry on your bed. So your bed will become for more than one purpose. So you have to learn that the bed in the bedroom is only used for sleep. Okay, see whether it's possible, see whether by doing that you can change the time and quality of your sleep. Actually, there's a lot of resources online. This is the Hong Kong Association website in Taiwan, and other countries have this medical website. You can go look and see whether you can improve your sleep from those websites. If I have more time, more resources to do other things, what can I do? The second thing is try. Keep learning, because when you are learning, actually, it will help your cortex. When the cortex is healthy, more healthy, perhaps your mental state, your frail state may improve. Good news, there's a research when you are learning. You don't have to learn too much. Every week, get some old friends. 3 times a week, each time about 2 hours, you can learn very, very simple, fun things like language, music, painting, photography, for instance. You don't have to learn very difficult stuff. What we've realized after these few weeks of learning, the cortex function is much better than before, and you know how effective that is. It may last for over a year. See, think about it, how important it is. In BC, we are lucky. We have different resources like UBC for 60 people, 65 and over. You don't have to pay a fee. You can go take some courses and other places to save. This is in Toronto. In the university, they have courses for us to look at. What you say, my English is not so good, what should I do? Never mind, you can look at overseas, like Hong Kong University. They have similar courses. Some of them, a lot of them are free. You can try to keep learning, maintain your mental health. If you have more time, other resources that can be do. What can I do? Try exercising, right? You can feel a lot of exercise standards. You at least maybe 3 times a week. I have 10-20 minutes each time. Maybe that's a good start. It can help you improve your mental state, help you improve your frailty. Maybe there's some improvement. Very simple. Just simply, you can't do much. What about walking? Just walking, right? You can try that. And next one, what can you do if you have more time? Learn new strategies. Sometimes you have to solve the problem. You solve your mental state, your condition. Perhaps what you have to use is use a different angle. I have an IQ question for somebody. A big size guy went to open the door, can't open the door. There's old lady waiting. I say, use more force, use more force. But this is a big size guy, but he couldn't open the door. The old lady said, oh, I'm agitated. Okay, go away, let me. The old lady could open it easily. Why? You know why? Oh, actually, the door is not for pulling, it's for pushing. The big size guy used all his strength to pull the door. No use. Of course, he couldn't open. He just push it. So it's just the way of looking at stuff. Perhaps that it would be helpful. A lot of the people told us you can learn different strategies, use different method to look. It's may be good, may change our mental state or condition. Another thing, use pads if you have more time. Some people tell us actually pads are useful. What can pads give us? Give us structure and also give us direction. I have to take care of the pet. It gives us a direction, sense of direction. It may not be dogs or cat. patient like a chicken. Looking at the chicken running all around, the patient is happy. So you see that many ways. In BC, we are lucky. We have different community resources like iCON is a community resource and different information we can try to learn. See whether it can bring us new knowledge.
So BC government also has lots of different services and for seniors. So yeah, take advantage of those sources in our educational institutions. For example, here you have this self-management BC, and then so we can learn different skills. So today I'd like to give you some information from the psychologist perspective. How can we improve our emotions and make sure we have we can better deal with this issue of frailty? Thank you, Dr. Yang, for your detailed information and how to deal with depression, and also lots of tips for us to we can try. So this morning we have learned a lot, and we have 2 more guest speakers to share with us on different topics. And just now, Nicole and Emily, did you do some simple exercise? Yeah, to stretch and to stand up, and I did that because I've been sitting for quite a long time. So when it's safe, you can try that. You can stretch your body. And now let's listen to the other 2 guest speakers. Just now, our guest speakers mentioned, and Dr. Ho also mentioned, like the medication management, and some medications would affect your functionality. And Wendy just now mentioned some medication make you feel dizzy and reduce your balance and make things easier for you to fall. So when you age, you have more and more medications, and so we are quite fortunate to have Mr. Ken Ling, a registered pharmacist, to talk about medications and seniors, how to manage medications. Hi, Ken. Hi, Barbara. Yeah, the floor is yours. Yes, thank you so much for iCON for inviting me again to talk about medications. And you've listened to my lectures before. We talk about the same thing, but then these things are important. You have to pay attention to. So today, and just like before, let me move on to my next slide. So I'd like to talk about just like what we do before, the services and the role of pharmacists, and why we have to understand the importance of medication management. We have to know what we are taking, what medications we are taking, and then how they can help us. And also we try to recognize the potential risks of medication use, because we know medications, they are quite effective to help you, but then there are also risks involved. Also, we learn the strategies for promoting medication adherence, because when we get older, we take more medications and more complicated medications, and how can we make sure we are eating the correct medications. So first of all, pharmacists' roles and services. And maybe you all know that pharmacists, they dispense prescription medications according to prescriptions written by the prescribers. Yeah, that is the basic role of a pharmacist. And also to make sure patients take the correct medications, and also answer inquiries that are related to medications. And sometimes we feel shy. Pharmacists are quite busy. We don't want to bother them, but they are actually our responsibilities. So because you get your medications from us, so we have the responsibilities to make sure to tell you the medications they are what they are used for, and then the risks involved. So you can ask questions. And also we try to provide vaccination services. For example, the COVID vaccinations, and also different kinds of vaccinations for flu and these common vaccinations. That's what we do. And about 2 years ago, we started to do more things. We have expanded the scope of our practice. Things like a minor ailment assessment, like if you go online, you can find a basic College of Pharmacists. We have a list of 20-something minor ailments, and then we can also prescribe some prescription medications, because there's might be a waiting list when you want to see your family doctors, and then so you can make an appointment with a pharmacist. So first of all, the importance of medication management. Why this is so important? Well, whatever they give me, I just take, right? I just take whatever I'm given. But you have to understand why we take that medication, what it's for. So the importance is that it's easier to ask pharmacists what medications you need when you are out of medications. So you go to a pharmacist, and the pharmacist would ask you, what medications are you here for? You have to know, oh, this one is for blood pressure, this one is for cholesterol, and that one is for my diabetes. So if you know what the medications are for, but sometimes it's hard to remember the names, right? So you write them down, or you take the pill bottles with you, and then you can tell clearly what you need. And also, another reason is that to minimize the chance of taking the wrong medications. So, because you will get a bag of medications, lots of bottles, and then if you don't know the names and all the functions of the medications, once you are familiar with that, then you just reduce the chance of taking the wrong medications, because you know taking wrong medications that would be harmful to your health. And also during emergency situations, like you call the ambulance, or you just fall on the street. So it's easier for you to let, if you have a piece of paper listing all the medications you are taking, then it's easier to let healthcare providers know your list of medications that you are currently taking. Then you can get your appropriate treatment. You are on some medications, and they have conflicts with other medications, right? So you have a list of medications that you are taking. You have that list on you. Then it's easier for the healthcare providers to have a better understanding of your medications. And other reasons why you have to know your medications. It is to ensure the medications are not resulting in adverse effects, because some medications, they have side effects. That's quite common, right? And then after a while, and then your body gets used to the side effects. But some medications, if there are some side effects, then they are abnormal side effects, then you have to let your doctor know or your pharmacist know, because the side effects might be quite strong. Some are quite mild, but some quite severe ones, and that would affect your daily life or make you feel dizzy or easy to fall. And those side effects, we have to take them seriously, and then which are normal ones, which are not abnormal ones. And also to avoid drug interactions between medications, because between medications there are drug interactions. We try to avoid them. For example, you have a prescribed medication, and then it just so happens you have a flu or a cold, and then you get some over-the-counter flu drugs for your coughs, for your colds, and then these prescribed medications might have conflicts with your over-the-counter medications, and the conflicts you are not aware of, and then so you have to get some advice from your pharmacist to find out whether they can go together or not, because sometimes they are not supposed to go together. So once you have a clear understanding of your medications that you have been taking, then it's easy for you to get advice from your doctor or your pharmacist, and also to ensure the medications are effective and necessary. Then maybe you are on lots of medications, and some of them you've been taking for quite a few years. But maybe the diseases are already gone. It's not necessary for you to continue taking those medications. For example, something with your stomach is wrong, and then you were given a medication, but then now it's unnecessary for you to continue taking that medication. So you have to make sure you have a good understanding of whether the medication are still necessary, or because if the problems are gone, it's not necessary for you to take those medications. And pharmacists, other than what they do, they give you the prescribed medications, answering your questions. Also, they can do medication review services. You can call your pharmacy and make an appointment if you have some questions. You can, when you pick up your medications or your lots of medications that you are on, then you can want to sit down to go through the medications for 20 or 30 minutes. Yes, we are ready for that, but you just have to make a phone call to make an appointment. And then every 6 months, we can review the medications that you are on, and the medication you are taking, whether it's prescribed or over the counter, and to go through those medications and to see whether they are really effective, or to see whether they have side effects. And if there are side effects, ongoing side effects, to see whether how you are affected. Some side effects, for sure, there are some side effects. Some side effects are not supposed to occur. So you can sit down with the pharmacist to look at those side effects to see whether they are expected or not, or you can some other better choices for your medications to reduce the side effects. So this is something we can do. We can provide these services. So our pharmacists can provide these services. You just contact your pharmacist and to make that appointment. And these are the medication review services, 20 minutes, 30 minutes, and then the pharmacist might find that some medications are necessary, some medications are not necessary. Then the pharmacist can contact your doctor with a suggestion to adjust the medications, the dosages of the medications or the medications, and then to get the optimal results. And this service is 100% free. It's sponsored 100% by the government. So don't worry about the costs or our time, because the pharmacies, they have the human resources to help you with that.
I've said earlier, to abuse medication, actually there's some potential risk. You know, when you're sick, you go see a doctor. After seeing the doctor, if you are not taking medication, you will not treat the medical condition, because this person maybe psychologically you feel that after seeing the doctor I'm okay, but if you don't obey the doctor's direction and take the medication, maybe it may not be helpful to your condition. So you have to understand the importance of taking medication, taking on time. Do not overtake medication, and also do not forget to take medication. I said earlier, if you do not take the medication, actually it doesn't treat the condition. If you take too much, it doesn't mean that it's better. So you have to take regularly according to the direction. Because between medication, they have interaction, so you have to be careful. Some people, maybe they want to be thrifty, they use some expired medication so they don't have to fill again, but actually there's a potential risk for taking expired medication. A lot of the expired medication will have reduced effect, and also some medications after a certain period of time, the chemical composition may change, so it may be harmful to the body, may be toxic. So what we see that the medication, once expired, should not be taken. You bring it back to the pharmacy. They will help you dispose. Of course, do not flush down the toilet. Bring back to the pharmacy. They will take them back. And also, if you buy your own medication, because there's a lot of non-prescribed medication for blocked nose and those over-the-counter medication to a lot of people, high blood pressure and high cholesterol or diabetes may not be useful, because it might increase your blood pressure and your blood sugar. So you have to check with your pharmacist first. Of course, you have to provide the prescription medication that you're taking to him. When you age, perhaps the number of medications might increase. Look at this picture. You look at how many bottles, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So it's not surprising. Some people really need to take 10 or more medications. How can we take on time and without making errors? Because some you take once a day, some you take twice a day, 3 times a day. So how can we remember all that? Actually, there's a way to remember. The most original is your paper. If you're more high-tech, you use your cell phone or your electronic pad. You can write it down at breakfast. You have to take this one, how many. At lunch, what do you take? Dinner, sometimes it's 4 times. Sometimes you take 5 or 6 times. When you write down the time, then you will remember. At least in a day, you can check 4 times. That should do it: morning, noon, afternoon, and before bedtime. And also you remember the name. If you think you still do not remember, the medication must be put in front of you before you remember. Then you can go to the pharmacist to buy this package. So this would be separated into morning, noon, afternoon, nighttime. So the morning medication would be all in there, and noontime and nighttime and before bed you can do the packing yourself. You can pack for a week. Then you will not take it in error. Of course, when you pack, it has to be more accurate in time, in terms of timing. You can ask people for help. You can also ask the pharmacist for help. At the pharmacy, we can help you package. You can see on the right-hand side, that's what is packed for you by the pharmacy. Essentially, it's the same principle: morning, noon, dinner, and before bed. When you see that, you should not forget. Some people still forget. They absolutely do not forget. They do not remember that they have to take medication. In this case, in this 21st century is a high tech. Some pharmacy would provide a dispenser, automatic dispenser. Not every pharmacy would have. You can ask your community pharmacy whether they have it. This dispenser will be given to you to bring home at the designated time. The medication will be dispensed. It could be connected to your smartphone. If you want to know anything about this automatic dispenser of medication, you can check with your pharmacy to see whether this related service is provided. And more senior people are more senior or with some mobility problem, and they need people to go to them every day to make sure that they take medication on time. And for home visit, the pharmacy that I work in, they provide this service every day. There's a nurse or pharmacist that would go for home visit. They would deliver the medication, and also they want to ensure that the medication previously, whether it was untaken, whether the timing of taking, they will watch you and they give it to you to make sure you take it before leaving. And also depends on because they would come do home visit every day, and to make sure whether there's fall or any other issue or whether there's any side effect. Some pharmacy would hire the nurse or the pharmacist to go for home visit to give the medication to people. If you need this kind of services, you can check with your pharmacist. And here, there's some community resources for your reference. Say, for instance, here, HealthLink BC, the BC Health Link 811 is a 24/7 service. If you want to know pharmacare subsidy, BC Pharmacare, you can click on that link. You can find out. Actually, how much medication is covered by the government, whether there's any subsidy. And there's also fair pharmacare plan. I said earlier, pharmacists would also help you, give you injection, or if you want to know whether it's time to take the booster, say for COVID, the booster, whether it's time now, you can go online to check. If you need the pharmacy for some minor illness or some prescription medication, you can go online to find out what's the process, or you'll call your community pharmacy to see how they could treat minor illnesses. Okay, thank you. This is my part is done. Thank you, Barbara, iCON. Thank you, Ken. It's so telling us so in such detail why we have to take medication appropriately for senior pharmacy, and the pharmacists provide so many different services, so people, you can just go and make your inquiry, rest easy, don't be worried about troubling people when they are busy. And everybody can do this poll. You can do it later for us. Okay, we come to the last but not least speaker. She's an experienced community worker, registered psychiatric nurse, and she will bring to us local, lower Vancouver information and services, what's available from the government for your reference. You can do your choice, your option, people that you should contact. We'll listen to Wendy, who will introduce to us. Hi, everybody. I'm Wendy. Today, I'm very glad to come to iCON's webinar to meet with all of you. Today, the topic is what's community resources are available or how to access community resources, and also I will briefly talk about going to care home or advanced care planning options, what are the prerequisites, and I also talk about advanced care options. Before I start, I want to recommend a book to you. That's BC Seniors Guide. You can go to the community. They might have a book for you to pick up. The most convenient thing is to go online and download the Chinese edition. Inside, they have very detailed information with phone numbers and other information for you to have a look. Actually, in the book, you can leave it at home as a backup, and it's good, right? Okay, today I will talk about community care adult day program. Right now, I will talk about Family Respite Center. Family Respite Center is a Family Respite Center. Actually, is sponsored by the government. How do you obtain that service? In near your home is divided by neighborhood. In the neighborhood, case manager will be able to help you. What's in there? Actually, it's just like seniors' home. They have very few rooms, but it's for the senior people to stay there temporarily for a certain period of time. For instance, if family members they have something on, they have to go traveling, but they don't have anybody looking after the senior at home, so they can go to the respite center. I know you can stay 30 days in a year, and we'll continue to talk briefly about following that. Special needs for transportation, handy dot, yellow bus. If you want to apply, if you want to go see the doctor, or you can make an appointment for them to come pick you up and send you back. You can download from their website the application form. When you download the application form, you can go to your family doctor. The family doctor will help you fill it up, and you can mail it. Or sometimes you go to the day program. The workers there might help you, might be able to help you apply, or the community case manager might be able to help you apply too. And after that is Meals on Wheel. Meals on Wheel is a group of social workers. A group of volunteers that help deliver meals to you. They have rice, they have dishes, they have soup. Is for senior people who live on their own at home but who don't wish to cook. That's one option. And lastly, I want to talk about Alzheimer's Society in BC. Alzheimer's Society. In the society, you go to their online, you have a lot of resources like seniors. It may be you have a frailty, you need to get some information as to how to communicate with them, or you want to know how the condition might change. They have a lot of information in there. And also there's this phone number. The HealthLink BC is a group of professional people who will answer your question about your professional care. Maybe there's some illness and how you don't know how to deal with it. You can call 811.
So these are the resources, and if you have the he can afford the time, you can look at something that write down their phone number and their website and to make good use of them. And I'd like to tell you in detail this home support service. Home support service is also sponsored by the government, and they provide services, individualized services. And for example, you need someone to help you with the shower, go to the bathroom, or to prepare your meals, or remind you to take medications. So how to get the service mostly is that you have to find your case manager, the community health workers, and you have to first call a hotline number, and then you can leave a message, the name of the senior, the care card number, and also what services the senior needs, and then so that when they need more information, if they are eligible for the services, and then they can refer you to your local community, the case manager in your community. They will pay a home visit and to assess what services can help you. And then other than what we talked about, also the adult day program is also sponsored by the government. Again, the case manager will help you apply for the service, and sometimes, most of the time, a senior lives alone, or other family members have to go to work, so it's just the senior staying at home. So that is why this is quite something ideal for those seniors, the adult day program. So this is how things go. Usually in the morning, around 9 or 10 o'clock, they pick up a senior. Just now I mentioned handy dart, and then they will. Once you are there, you drink some tea, and then you do some exercise, you chat, and then you do some other activities, games and artwork, and some mahjong tables so that you can play mahjong. And so it's quite activities good for your health, and then your lunch, and then take you back home. So usually once a day, you begin with once a day, and if you like it, then you can try 3 days a week. So this is one example, Cedar Cottage Adult Day program in East Vancouver, and they usually have 2 groups. One group is for Caucasians, and the other group for Chinese seniors. If you can speak English, then it's quite easy for you to communicate with those who speak English. Just now I mentioned home support service, and just now I also mentioned their services. They provide individualized services, but some seniors might say, I need someone to help me with some very simple housework, house chores, and so this is something quite a good chance. It's better at home. It's sponsored by United Way, and you have a group of volunteers. They come to your door to help you, and they can make appointments if you want to go see a doctor, or some simple housework, and some grocery shopping, and to snow removal in the winter. And how do you apply for these services? Well, you can use the websites and also the phone numbers. And they charge a little bit. Okay, and these are the government-sponsored services. You have to go through that case manager, and also some services you don't have to. In your neighborhood, there are neighborhood houses, so you can find your neighborhood house. And this one is Frog Hollow neighborhood house in East Vancouver on Grandview at 3rd Avenue. And this neighborhood house, they help seniors, and also there are children's programs and adults programs, and there are lots of services for seniors. And if you want to do Tai Chi, or you want to do dancing, or you want to do gardening, and this neighborhood house, they can provide lots of activities. Okay, so neighborhood house, where can I find the neighborhood house? It's hard to find them. I don't know how to go online. Well, there's a program, a very helpful program. It is called the social prescribing program. Social prescribing program, and the workers will help you find the information. If we want to find a center, I want to do Tai Chi, or I want to do dancing. So these workers will help you find. For Hollow has that services, and on what days of the week, from when to when, and then they can help you find the materials, information, what bus to take. So it's very, very helpful. So how to find these workers? You can see the slide here. You can see there are several locations. You can contact them. For example, Success in Chinatown, and also for Hollow Neighborhood House and Collingwood Neighborhood House. It's Franville at 22nd, and then it's you go to those locations and to get your services, and then they are very, very helpful, and they quite warm-heartedly to help you find those resources. So those are the community resources. Now let's talk about how to get to the assisted living facilities. You can see the image here. They look so beautiful. Yeah, very cozy. So it's when you have to live independently, and you can make decisions independently, but then physically they are weak, they need some help, then they can, it's a good choice to go to this kind of facilities. And so it's the case manager from the Ministry of Health can help you. I always tell my clients that if you want to get to this assisted living facility, first of all, you have to you try to make good use of the community's resources. For example, your home support or your day program, and if your family members will hire some private caregivers, these are they take into consideration when it comes to your eligibility. So they also reduce 70% of your income, and lots of activities in the facility. They have their own facilities activities, and also exercise, and also do some artwork, bingo games, and they have their own shuttle buses. Like you want to buy something, they can provide these services. They every week or every 2 weeks, they go to the nearby supermarket, and for example, TNT, and they provide the transportation, and they usually they provide 2 meals, lunch and dinner. In the morning, they no breakfast because some people, they don't want to get up so early, but then they have their own kitchen, so you can cook something for yourself, some congee, some tea, and also the workers there, they can every week they can help you do some cleaning work and washing laundry, and also one shower per week, and also you have the bathroom in your own room, and also kitchen, and also your sleeping room. And then once, if it's necessary, you take a shower once a week. The workers can also help you with your showers, and they also remind you remind you of your medications, help you with medications. Okay, so after we are done with assisted living, and they are for seniors who can live independently. If you are getting weaker and weaker, and if your family members are too busy to take care of you, then you can think about the long-term care homes, seniors' homes. They are also subsidized by the government, and we have quite a few available. How do we apply for? So how do we do that? So case manager will do the assessment, and if you are eligible, then they can put you on the wait list, and they give you the name. So I strongly recommend that you talk to, if you like this seniors home, then you contact them, and then you pay a visit, and then you can find out whether the senior likes it or not. And if a senior can't wait for these 3 homes, they also have this emergency placement. That is the emergency placement, and then the eligibility requirements are that you have no other choice. When there's a space, then that's the place you have to go, and then you can. It's not that the one of the 3. It's not the case. If they have the space, it can ask you, do you want to go back to the one of the 3 that are your choices, and that's the time you can make a decision then. Or another scenario to get into the home. For example, you are hospitalized, and then when you are discharged, and then the hospital will do an assessment whether it's suitable for you to go back home or go directly from the hospital to the home, and that is how you go through emergency placement to see where there's a space, and then you go to that home.
Senior will be sent there. We've talked so much about seniors home and community resources. I want to talk about advanced care planning. Usually, for us Chinese, we would do a will, but will is only takes effect after we are gone. But when we're still alive, what can we do that would help us when we are still alive? I will talk about these 2. One of them is enduring power of attorney. Enduring power of attorney, this is mainly to help you with your financial and legal decisions. Actually, I agree. I am in support of seniors doing this enduring power of attorney. Why? Sometimes we may have worse physical condition. We can't go to the bank. Sometimes seniors may not know how to go online to do online banking or checking, or sometimes the senior may have a stroke. After the stroke, maybe they're not so lucid, they can't make any decision. Then the financial matters, who would be in charge? Or maybe there's a senior person is frail, memory gets bad from worse. I can't remember everything, and who is going to be help them? Then if you haven't done your enduring power of attorney, then it would be a little bit more problematic. So I am fully in support of having an enduring power of attorney being done. So you can go to the notary public or go to the lawyer to have one done. When you really need someone to help you, that would be the person that you appoint, designate as your power of attorney. Then the person will help you with your financial and legal decision. And also another one is a representation agreement. A representation agreement, that's called a representation agreement. There are two chapters, Chapter 7 and Chapter 9. In Chapter 9, this agreement mainly is, for instance, when, let's say, if you're hospitalized later, what's your will then? If in terms of medical care, what is your decision going to be? This would be your decision made before going to the hospital is better than being in the hospital. And everybody is hasty and nervous and in a bad mood. If the doctor asks, what do you want to do? You want to have a resuscitation or so. Maybe it won't be, the message won't get to you. So maybe it's better that you be asked first how we will be able to help you when you're in the hospital. Then it'll be so easy to deal with it when you're really in the hospital. In Chapter 7, actually is a combination. It combines the power of attorney, meaning the family member could help you with your financial and legal matter, and also once you decide your future medical treatment, this is a combination of the two. If you want to do that, then you would have to go to either the notary public or the lawyer to do that agreement. Okay, coming up is our community resources information. If you have any question, you can go on the site and see if there's any need. You can copy down and give them a call to make inquiry. And all these are community resources, what I talked about earlier in my topic. Okay, lastly, let me say one more thing. We say if there's an old senior person at home, is like a pressure at home. So do not lose a pressure. Do not lose a treasure. So we have to treasure the treasure at home. So thank you for coming to our webinar. See you next time. Bye. Thank you, Wendy, for your detailed introduction and explanation about community resources. There's some upcoming events. We are busy in July, August, September. In July, we have 2 dates that's been scheduled. One is July 12th, one is July 22nd, both in the morning, 2 different webinars. Is to do with the summer extreme weather series. One is managing chronic kidney disease during extreme summer weather. The second one is chronic disease management during extreme environmental conditions and wildfires. And also in terms of respiratory system, we have 2 speakers to talk to us. And that's in July. In August, Tuesday, August 13, using apps to support your health. We also have Wendy, who talked to us today about fall prevention. She'll talk about that topic. And on August 19, we go back to today's Q&A session. If you have any questions, you can write them and send them to us. We will arrange for speakers to answer all the questions raised. And in September, that's our annual the Success Health Fair. That's on September 15 on a Sunday. It's an all-day activity. iCON arranged for 2 speakers. One is specialist doctor to talk about chronic pain management, and the other speaker is family doctor to talk about using apps to support your health. I hope you all will pay attention. And your way of contacting us, there are many ways. You can see those on the screen. Keep in touch with us if you are subscribing to our the newsletters. You can join in this email correspondence. There will be, when there's a webinar or other activity, you'll be informed directly. iCON, thank you very much to the Patient as Partners Initiative support, and also we are thankful to our community partners. Thank you to our media partners. Thank you to all the viewing hubs community partners. Lastly, we are also very grateful. Thank you to our speakers today, including Dr. Ho, Amy Yu, etc. Lastly, we have to thank all our several interpreters behind the screen doing the interpretation for us, Shiny, Susan, Linda, Adam, and also thank you, MB Interpretation Services. And hopefully next time when we have the webinar, we'll meet with you again.